Hit that live button. It's always exciting. What's going to happen? What's going to happen when we hit that live button? Well, I think good things are going to happen today. I have faith. And I've got two great guests. We're going to talk about how we can keep physicians in the healthcare field and not have them leaving the field, because lots of physicians have experienced burnout, so much to the point where they've even left the profession. So we don't want that to happen. We're going to help out, and I've got two great folks here to discuss that with me. They have walked in the shoes of physicians. They actually are physicians, so I think these are the right people to talk to. So I'm so happy to have you. Dr. DeRouen, welcome to the show, first of all.
Thank you for having me.
Awesome. And also, very excited to have you as well, Dr. Tisdale.
Thank you, sir. Glad to be here.
So if you are not following either of these two individuals, I would say you need to do that, because they're two folks who you want to watch. To Dr. DeRouen, to her point, is a podcaster. She's got all things going on. I've seen her have all kind of speaking engagements and all those wonderful things. Active on Instagram. And then, of course, Dr. Tisdale, physician executive, now turned entrepreneur. And I love to hear more about that story, how that's evolved. So we got lots of things to talk about. I'm loving that you guys are staying in the healthcare field. That's what I'm the most excited about, because we need folks like you in the field. Folks who are just signing in, let us know where you're signing in from, what city, what state, what country. Well, we want to know. And as we go throughout this discussion, please chime in with your comments, your feedback, your questions. We want this to be very interactive between all of us here today. So to kind of help get us started, and I really have been concerned about this, as I've read the headlines, I've read the stories, especially with COVID. Even it's put that much more stress on our physicians. And so, Dr. DeRouen, would you like to get us started off? What's your top thing that you're noticing right now that's top of mind as you look at the landscape with physicians?
That's a really great and large question. I think that there are so many variables going on right now, especially during the pandemic. We've had a lot of physicians who initially in the pandemic may have had changes to their structure, whether or not it be due to administrative purposes, where they were repurposed to different job duties, or had to go to telemedicine, or had to go inpatient, or they had families and they had to figure out how to maneuver taking care of the children from home and things like that. And now we've been in this state for over a year. So I think it's brought on a lot of reflection for a lot of people, figuring out what their next step is and what may be right for them, just given all of the change and the losses and a lot of different other factors.
Absolutely. Those are all great points. Dr. Tisdale, from your perspective, what are you seeing?
I think that the biggest blind spot in our industry right now, and it's ironic that it's a blind spot because this is the healthcare industry, but I think that the biggest blind spot we have where physicians are concerned is physician health. When we use euphemisms like burnout and balance and all of these other social stressors and COVID and all of the different things that physicians endure on a daily basis, what we're really talking about, if we really boil it down, is physician health. And I can tell you I really can't tell you how many different orientation sessions and interviews and recruiters I've interacted with over the years, and that phrase never comes up. They never talk to me about what the organization has done or is planning to do to invest in physician health. And I think that's incredibly ironic, because we are the ones who are directly responsible for care delivery and ultimately responsible for making sure that care is reimbursed. But there is very little, if any, and this is documented, investment by organizations for physician health. And so I think that these are glaring issues. We have a pandemic within a pandemic that has been going on for quite some time now with physician suicide. Every year, 400 to 500 physicians take their own lives. And I think we really need to examine how people who invest so much time, so much money, so much human capital into earning these credentials decide that they no longer want to live and that they're going to end their own lives. So I think that physician health is one of the biggest blind spots in our industry right now.
Wow, that is, I've never thought of, I've had lots of discussions, and you're right, that has never come up. I've heard them say things like, what do they say? Like they might say well-being, or they might say wellness, but not health.
And there's a difference, and I'm glad you pointed that out, because wellness assumes that you are, at least in my mind, that you're always in a state of great health, that there's nothing wrong and we just need to maintain your current state. This may come as a surprise to a lot of people, but physicians are human beings. So we get sick, we get depressed, we get anxious, we get overwhelmed. This past year has been nothing short of brutal for most physicians. And so I think that there's a difference between wellness and health. Just like we have well and sick visits, we have well physicians and physicians who are sick, socially, spiritually, emotionally, physically, mentally sick. And it is very difficult to protect your career and address your health as a physician. And that is something that we need to have more conversations about.
Wow. I'm curious what the audience thinks about that particular point. And they seem to agree with you there. I don't know if you see that, but
I can.
Yeah.
It's interesting, Rollis, I was reading a white paper by a very large research firm, and it talked about a report from 2018 that really examined physician burnout and depression. So first of all, the fact that we have to have a report on physician burnout and depression should be a huge red flag to every recruiter and every organization in our industry. We literally have reports about physicians who are suffering with these issues. And so I still find it, again, ironic that we have all of this data. We're data-driven people. We get up every day with the plan to give of ourselves and our expertise to others to make sure that they are receiving exceptional care and that their health is the best that it can possibly be. But no one is having that conversation. And I think that of all of the terms that are in our contracts and in our employment agreements and all of the things that organizations and recruiters think are going to be beneficial to us or incentivize us to work with their organizations, I think that should be number one. It should be the first thing we talk about on the phone. It should be a major part of our interview. It should be a question that we're asking as physicians, not necessarily waiting to see what someone's going to say, but maybe they've never thought about it before. And you could be the first person to come into that organization and really shine a light on something that is long overdue to be brought out in front and talked about in a safe space for physicians to where it's really being addressed.
Absolutely. No, this is a great point we're on. So I'm curious, Dr. DeRouen, from your perspective. I mean, you're on Instagram. In fact, I know you just got this new book here about women of medicine, and you're there in that book. So what are you seeing? Are you seeing the same thing she's saying? That people are not mentioning physicians' health? Because I agree with that. I haven't heard of that at all.
Absolutely. And I think that Dr. Tisdale explained it quite well, where people forget that physicians are human beings as well. It's natural to have the different phases and emotions in life. We definitely need to bring back the humanism in medicine, regardless of how far we get into technology and all of these other things. There's that human component, and people are happy, but everyone's not happy all the time. And there are always stresses. So even if you think about a typical day of, say, a primary care physician, where in one room they may be celebrating someone's new baby and doing a well child visit, the next room they may tell someone about a new diagnosis of cancer, and they may cry with them or hold them or something, and then you may be double booked or have the next patient where you got to go in and they're complaining about you being 5 minutes late when you were having a gentle moment with someone. So it's all of these things, and you kind of have to be like an actor and kind of forget what your emotions are and move on to the next. And sometimes that can eat away at physicians, as any human being. And then there needs to be that support system, and not just wellness, but mental health. Dr. Tisdale mentioned about the high suicide rates that are rising. And it is very concerning that as physicians, there are barriers to care for mental health illnesses. If someone were to seek certain mental health problems, and people have sometimes even higher rates of certain mental health conditions being in the medical community, they would have to report that to the medical board and things like that, which is a deterrent for people getting the help that they actually need. So it's kind of becoming a blocker for helping people perform self-care because they may be afraid to even reach out. And we have all of these things coming up. I had a lot of conversations with physicians, even on my podcast, where they're talking about states of well-being and what helped them persevere or overcome the quote unquote burnout. But a lot of it is just kind of taking that time out. And a lot of those doctors were kind of driven out of medicine or the traditional realm. And you mentioned Instagram and things like that. And as we all know with social media is wonderful and it provides education to patients and it meets people where they are and things like that. But it's just one component of a particular day. Someone could be posting an extremely happy post, but be crying or something. It's not real life.
Yeah.
So the grass is always greener and you're not going to post hopefully negative things. So social media is just one aspect of someone's life. So we need to take that time to just bring back that humanism in medicine and actually check on how people are doing.
Oh, yes. Those are great points. Okay. So what I'd like to do now is just for our viewers to know, because I know quite a bit of your background, but I want them to kind of know. So, give us a quick synopsis as to why you entered healthcare, Dr. Tisdale, and your background in healthcare, what led you to the point where you are now.
Well, I'm a pediatrician by training. And so the reason I chose that is because I truly believe that children are humanity in its purest form. They are what represents pure humanity before we learn what to be afraid of or angry about or hold on to or resentful toward. We are children, and I find their energy refreshing no matter how tired or stressed I am. And that is saying something for the level of stress and fatigue that we deal with as physicians. But I started my career as a hospitalist, so I take care of sick children in the hospital, in the emergency room, taught trainees, residents, medical students, decided that I wanted to understand the business of medicine and I wanted to be able to speak the language of business so that I could speak medicine to my colleagues and business to our business folks in the hospital. So earned an MBA in finance in 2016. I've served as division director, chief medical officer, entrepreneur now with Dr. Honeymom. And part of the reason I created that space is because of what Dr. DeRouen was talking about just a few moments ago. The expectation of perfection is on us all the time. And it is at times nothing short of unbearable. And so if you can imagine, Rollis, how many mistakes maybe you've made today, just random mistakes. You forgot your car keys or whatever. When you're a physician, there is a zero tolerance for error environment. You are not allowed to get it wrong. And I'm not saying I disagree with that. This is a high stakes profession.
Right.
What I do think, though, is that the healthiest physicians are those who found or created a safe space to make mistakes. And so Dr. Honeymom gives me that space. I can make a million mistakes in a day with my business, as I'm sure Dr. DeRouen can relate to, and it's okay. And so I've gotten back to being able to tap into my creativity because I'm allowed to make mistakes on purpose. And so that's the next level for me, being able to provide a great service and grow a business, but also get in touch with the person who was brave enough to go to medical school in the first place, knowing that most people don't make it to the end of that finish line. The same bravery and willingness to fail I had then, which equals courage to me, is what I have now with opening my own business. So that's the journey. We'll see what happens next.
I love it. And I even see that there's some doctors that are already excited about it. So that's a great thing. There you go. Right there. And then, so Dr. DeRouen, Erkeda DeRouen, tell us about your background. What got you into healthcare and what kind of led you to the point where you're at now?
That's a good question. I entered medicine probably in the more traditional route, as in I wanted to quote unquote help people. And over the years, I realized that there are a billion different ways to help people, but medicine is just one avenue which marries science and just the love of people and engagement. And from there, like I said, I've always loved chatting. I've always loved science. I've always loved people. So I've always been drawn to primary care. So I entered family medicine. And I was interested in family medicine. I was really torn in the beginning between family medicine or med peds. And for those who are listening who may not know the difference, family medicine is more outpatient clinical in terms of training, and work in MedPeds is more inpatient hospital medicine for both pediatrics and adults. So I went the family medicine route, and it was always my dream. I know in medical school I was on a rotation with an obstetrician, and she had this thing where she would have homegirl time because all of her patients were women. And we would take like the theme of the day by like looking in the waiting room at the magazines or what was on the TV. And we'd be like, okay, I think when I was doing it, Prince William and Kate had just got married. So we're like, okay, everybody, we're going to poll you guys on the dress. And we just hear all the different answers and stuff before we talk about the medical things. So I just love those relationships. So after that, I did some outpatient medicine, and I was also kind of feeling the burnout, and it was like, oh my God, what's wrong with me? It's too early in my career, because I was only a few years out, and I was just searching for something different. So I transitioned to doing full outpatient, like telemedicine, kind of before it was a thing. Who knew that 2020 would rev it up? But most people, when I started it, was like, that's not real medicine. What are you doing? So I decided to do that. And I also have started, as you mentioned, exploring other ways to engage in healthcare from a higher level in terms of promoting wellness through speaking engagements, educating through podcasts, as well as actually 2 upcoming books. One
nice.
on being is an anthology series talking about the experiences of women in medicine, and it talks about physicians in America, Australia. We even have someone in the book from South Africa. And my chapter, just to be honest, talks about, it's like a letter to Black women, future physicians, who may be struggling with the demands of being in medical school when you are in the minority. So that was a fun chapter to write about. And then the other book that's coming out towards the end of the year is a chapter on telemedicine.
Okay, very good. That's exciting. Okay, now what I want to ask, I'm going to ask both of these questions. I'm going to start with you, Dr. Tisdale. When you first came out of training and you were just imagine yourself back in your first position, and I know it was in peds, what would have made you, if possible, if there was anything, what would have made it a little bit easier for you to exist longer in that particular position in a happy, healthy state? What would have contributed to that? Because I kind of want to give facilities and hospitals, or even practices, ideas on how they can take those staff physicians and maybe extend that time out a bit. So I want to get your thoughts on that.
I think that it really aligns with something Dr. DeRouen was talking about. When we talk about bringing humanism back to medicine, it's amazing how many clients I can talk with who always think I'm talking about someone else. When I'm speaking to physicians and I say, I think we need to bring humanism back and we need to focus on health, I have to remind them that I'm talking about them. And so that really, this pathologic altruism that we sort of become indoctrinated with, I think is making us sicker. Separate LinkedIn Live we can have about that. But I really do think that what would have helped me was that conversation about, hey, we know that you're going to come in here and do an exceptional job and that you work hard. And we also want to talk to you about what it is that you need to do that and what it would take from us to make that sustainable for you. I left that job not because I hated it, but because it really was starting to affect my health, not just the work itself, but the hours, the demands. And I think that what is specific to women, as Dr. DeRouen was talking about just a few moments ago, is the expectation that we're not only going to do it, but that we're expected to make it look easy while we're doing it. And that is also something that is overwhelming and not limited to women. I think there are unique dynamics about it that affect women, but the unrealistic expectation affects men as well. They're not allowed to be breakable or overwhelmed, even though they're human beings also. So I think that conversation about what it would take from my organization to make this job sustainable for me would have been helpful, because I can also relate to having a patient on life support in one room and in the other room, it's a Band-Aid and you're okay. And so having to swing back and forth through that days and nights all the time was a lot. And it made it harder that I wasn't able to have that safe conversation.
And also, I've learned a personal lesson from this show already is, as a patient, to be more understanding, because, I can't leave my doctors later. They had me waiting in the waiting room, whatever the case is, not knowing they may have had to break some life-altering, serious news and just took a few extra minutes with a patient here or there, and here I am complaining about it. So anyway, I want to thank you both for my lesson you just gave me. Okay, Dr. DeRouen, you tell me, what in your first position that you were in, a staff level position, what would have helped you to stay happy and healthy in that position a little bit longer, even if that was possible? What would have helped?
That's a good question. I think it kind of boils down, even outside of my first job at a residency, I think it can apply to any job. Having kind of like the 3 Ps. I think having a sense of purpose, why you're there, is it valuable? Your purpose, of course, is to see patients, but hopefully to improve their health. How are you improving it? Are you just being like another cog on the wheel where you're doing it like an assembly line? Are you having that time to spend with them and actually make a difference and follow up with them and those things, depending on your role, because different physicians have different roles. Like me as a primary care physician wants that kind of relationship, whereas someone who may be a first-year surgeon, they're doing the cases and things like that, and they may not want that personal relationship, or maybe it'll be shorter, but something where you feel like there's a purpose and you're fulfilling it. The second P, I would say, is opportunities for professional growth. Different organizations are structured in different ways, and a lot of times you are hired for a certain role, and that's fine if that's what you want to do forever. But there are a lot of times, especially I think in my generation, where people are looking for professional advancement and not necessarily needing to go back and get an MBA or a PhD or something else, which those may help. But having some kind of avenue for professional development, even if it's not for another title, maybe they may be able to chair a committee or something so that they can grow in that way. And then the other one is just having some time for you, some personal. So like professional, personal, and purpose. Whereas you're not doing notes all night, like your system is efficient, you're able, or you have a scribe or something like that to help you have that, set those boundaries. So when you leave work, you have time for your personal time, you have time for your family, your friends, vacations, personal time off, and you're able to kind of enjoy those times and refresh so that you can come back and want to work more.
Oh, I love that. Okay, so I think it's time for a water break. One of my guests taught me this, that we should take a moment during the show and just take a little bit of water, a little water break.
Smart. If only I brought my water with me.
Physician health, Dr. DeRouen.
Yes.
Gotta have your water.
I'll drink one after the episode.
And
Yes,
Joanne,
ma'am.
we'll have to add this to the notes in our calendar invite to ask our guests to bring water, okay?
There you go.
So I wanted to also acknowledge some of the comments that we have here. And thank you, actually not Doctor, but Kim LaMontagne. She's big on mental health and helping organizations to be more cognizant and have a more healthier, safer work environment from a mental health standpoint. In fact, she's going to be on our show after this one. And I also want to thank both of you for being so understanding. Both of you. I was so scared to tell you guys. I was so scared. I didn't want to tell you that we had to reschedule because of what I had happened with my conflict. And so I want to thank you both for being so understanding. Thank you.
Life happens, and it's not only humanism and medicine, but like us just being understanding for one another. It's okay to set those boundaries. And if you can't do 2 things at once, reschedule.
Yeah, and so and the reason I want to say that here is because you practice what you preach. So thank you very much for doing that. Okay, I have a question for both of you guys. It's a little bit of a fun question. Is that okay?
Sure.
Okay. Okay, this is a would you rather question. Would you rather have an extra hand where one of your feet are, or an extra eye where one of your hands are?
I think I'm going to vote for the eye.
Okay, why is that?
Because I think this may sound weird, but I think there are always things that I'm missing. And it's everyone's vantage point. It's the lens they're looking through. It's their background. It's what they've been trained to think and all of their trauma, all of their life experiences. And so I don't know, I've always thought about our eyes being in a specific location for a reason, but I've always wondered if we would see things differently if they weren't. For example, children, and I'm always going to circle back to that because I'm a pediatrician and I love what I do.
Yes.
But children notice things because they don't see things from the same perspective or height or level that we do. And it's hilarious. It is very entertaining. And you can learn a lot from a child in a very short period of time because they don't know what not to tell you. So it's all based on what they see, what they take in. And so I think that might be cool.
Oh my gosh, that was an amazing answer. Thank you very much.
Sure.
My answer won't be as fun. I was going to say I too, but I was just going to say so I could see behind myself like by doing this.
I was totally doing that just now. I was in my mind, I was thinking just like that with my hand. And that's why I picked it too.
Dr. Tisdale, she just thought it through and
I really want to do that though, like seriously.
Wow. Okay. See, that's why these questions are so fun. That's why I like these things. Okay. So we're going to go back to our discussion again, which you guys did a great that was a great segue, by the way, Tisdale. Okay. So what I want to ask now is when it comes to, I guess, facilities or resources or what have you on site for the physician, because I think and actually Dr. DeRouen, she really hit on a key point that if it's something mental health related, you're saying they have to report it, so it makes it that much more harder for them to say, hold their hand up, I've got a problem. So it's possible a number of those suicides could have been prevented had they got the help.
Absolutely. Because if they report it, then they report it to the medical boards. And then sometimes when they're looking for other employment, they get all of that information as well. So it's kind of an unnecessary barrier when someone is in healthcare and they're just asking for help.
I got to tell you this. I've been a recruiter for 16 years. I can tell. I know it happens. People are getting filtered out because they have stuff on their background. The minute they see something like that, it's red flags, and they're like, okay, we got to do it's either more investigation, or let's just go with one of the other candidates.
Mm-hmm.
And that's really unfortunate.
It's, however, very, very true. And I think it's an excellent point because it's what we're really talking about here is the confidentiality of it. I think it would be difficult for a physician not to realize that they need help or that something is not right. But you're dealing with highly educated people who have invested a lot. And one of the things they don't want to lose is their reputation. That is very, very valuable in our industry. And so what we're really talking about is confidentiality. As Dr. DeRouen mentioned, that information is not kept between you and your mental health care physician or practitioner. That information is requested when you apply for a new state license, when you apply for different positions with different organizations. And there just isn't a great way for you to feel like it's not going to count against you. Ironically, though, and I'm always going to circle back to the conflicts, we are absolutely held to the highest standards of confidentiality for our patients. If we were ever able to let out the information that's in our minds or that we are collecting during the day from patients, you would be floored by some of the things people will come into an office or an exam room and tell us as total strangers, or some of the crises that we run into with families and children every day. And so we have to keep that information confidential, and we work very hard to do that because there are hefty penalties if you don't. But our information is not given the same consideration, and that's not something that physicians deal with very well. So it obviously doesn't incentivize us to get the help we so desperately need.
I'm almost getting emotional here. This is just amazing. I've never actually stopped to think about these things you just mentioned.
Go ahead, Dr. DeRouen.
Oh no, I was just saying it's something that's really prevalent in our community, and there have been in certain environments or different organizations or residency programs, they try to counter it with certain things where they'll have you do like Valen group and talk about how cases have affected you, or try to have some kind of on-site help where they could kind of do it in generalizations. But for people who may have more serious conditions, or honestly, I think everybody needs therapy, to be honest, especially with the different things that people are processing. Like we said, to go from patient to patient and kind of like be robotic. There needs to be some type of external person to help you process that and deal with it. But it just, it creates barriers for some people.
Yeah. Okay. I want to read this comment from Kim. She made a comment, which is very, very important to our discussion. Do you think that all physicians should be required to do some level of therapy, just so that it doesn't look strange if someone does seek it out? That way everybody gets it. I don't know. What are your thoughts on this? Is that crazy or what?
Well, so I think that the word required makes it a little bit uncomfortable. What we're talking about, and that may not have been the intent, but what I think we're talking about is the freedom to seek help when we need it, and for that help to be kept confidential.
Yeah, of course.
I don't think that it would make us feel less stressed or help a mental illness or any concern to make it mandatory, because then we start to get into the physician as health assistants or state-run programs that have not been held favorably in from the information that's coming out from them. Physicians have not spoken of them very highly. So I think some of those mandated, required programs are not there to help physicians. I think the benefit for that is being received by other people. So to stay on topic, if we're talking about what benefits physicians, it's the freedom to get that help when we need it and know that it's not going to be public information. That
was masterful. Thank you. Because I'm sure somebody else probably thought the same thing. So at least you just addressed it just now.
I wanted to make one other comment just before Dr. DeRouen gave her remarks earlier. I don't know if you've heard of Doctor's Day, Rollis. Have you heard of Doctor's Day?
I think I have in passing, possibly. I think
exactly. So let me just put this out there.
Oh my God.
It's okay. I wanted to say this. There is such a thing as the National Doctor's Day. And this is not just something that a bunch of arrogant physicians got together and decided should exist. This is a commissioned holiday by President Bush since 1991. Has been celebrated since the 1800s. So it is a real holiday. And you've never heard of it, even after a year and a half of a pandemic and thousands of physicians losing their lives. And so among the things we're talking about in terms of what it would take for us to be sustainable professionals, I think recognition and appreciation should be high on the top of the list also. And that is something that when Doctor's Day comes around and people tell me they're getting emails and that's it, or they're not even getting that, it's very deflating. Very, very deflating to not have that appreciation for all of the sacrifice that you make every day.
You know, you just made me think of something else, is that the past year, and because I'm in we do physician and nurse recruitment, okay? But I can just tell you that I've heard a lot more about the nurses being the heroes and the nurse week and all that. And that maybe that's just because that's the world I'm in, or is it because they actually are getting more and guys who are nurses, I'm incredibly grateful for what you guys do. It does not diminish what you guys do, but I'm just now realizing in my own mind as I'm processing what you're saying, I have heard more about nurses than doctors over the past year, and they're both right there working together.
Right. So that appreciation is something that physicians crave. We're just, again, sort of indoctrinated not to ask for it. And we're also not supposed to feel badly if we don't get it. And I just want you to sit with that for a few minutes, because if you had experienced the type of stress that physicians experience, and then that day rolls around and you hear nothing, crickets.
You almost got me to the point of crying just now, Tisdale. So we
well,
gotta be careful.
I'm glad that you feel that way. I'm glad you feel that way, because I want you to, you're an empathetic, smart individual. And I think that it's important for folks like yourself to feel it, because it's very difficult for us to explain unless you are a physician what it feels like. So I think that's important.
I need a moment here.
Dr. DeRouen, what do you think about Doctor's Day? I'm interested in your thoughts.
I remain quiet for a reason.
Gotcha.
But I definitely agree with you. Like, I agree with you, Rollis, too. Like, we are a team. So I totally support nurses. I support mid-levels, physician's assistants, everything like that. But I do think that the contribution of physicians to a team is undervalued. As you just said, you know Nurses Week, we have a day. I think they did in the past few years expand it to a week, but we still just get an email or a donut. And then on top of there's been a lot of hot conversation in the physician community as well, because as we do expand our teams, which are sometimes necessary, there has been a decrease in appreciation for physicians' roles and titles, whereas a lot of organizations have gone under the umbrella of calling providers or clinicians or whatever they want to call it. And it kind of, I think, undervalues the education that we have done, and also kind of lumps some of the appreciation days together, and it kind of demoralizes physicians. I think that most physicians are team players, and they definitely love working with teams and collaborating, but to lump, kind of to strip our titles away and to just say go work and don't ask for any kinds of kudos and things like that, it is not something that boosts morale.
Yeah, it definitely is food for thought. I tell you, you guys, I know there's probably people watching that are going through the same mental exercise I'm going through, just kind of evaluating what I've seen, what I remember, what I've heard, and it's yeah. So I'm on. Everybody's doing it on their own time, and we're just watching it. But I'm on screen. They're seeing me go through this on screen. So Kim says, I was denied health insurance, not life insurance, because of a history of depression, alcohol misuse, and suicidal thoughts. Very unfortunate and unfair, especially since the work that I do helps insurance companies get people healthier. We should not be punished for asking for help. She says it's okay to not be okay, and it's okay to ask for help. No shame. My nurse practitioner saved my life the day he held space for me when I needed help. I am alive and 12 years sober because of him. Oh, she has more. Physicians are people too, and should have the same access to help without any judgment. A healthier physician provides better care. We must take care of ourselves before we can take care of others, Rollis. Wow, that's
I just want to congratulate Kim for being sober for so many years and reaching out and even being bold and brave enough to announce that on this play. Like, I just want to give you kudos for that.
Yeah, absolutely.
And I'm sorry that the healthcare system didn't make the right decision in choosing to cover you. But it's great that you were able to reach out for that help if you were feeling that way, and you're feeling better now. Yes,
absolutely. And I mean this sincerely, Kim. This is... that right there, you are to be applauded for that, because you're helping others. You know, when she's willing to do that, it helps others be a little more comfortable to speak up and do something like that themselves. So, wow, this has been quite a session today. Okay, so what I would like to do now is let's talk about, or let's think about, what are some actionable items for a family practice, for a clinic, for a hospital. What's maybe like one or two things that is actionable for them? But before you answer that, I'm gonna give you a moment to think about that. Before you answer that, I have a little side question. Okay, if you had the ability to compete in any Olympic event, which one would you choose to enter? Dr. DeRouen, you want to start us off with that one? Which one would you enter if you had your choice?
I think I'm torn. I would either want to be like a figure skater or a gymnast. Oh. I have no skills in either, but those are the ones that I like to watch when I do watch the Olympics.
Okay, now let me ask you this. What if the figure skating and the gymnast, that was the two you said, right?
Mm-hmm.
Okay, what if you found out that your two favorite ones were on at the same time? Okay. Which one would you turn the channel to?
I probably watched the skating.
Okay, the skating. Okay, that's the real one. That's the one that's the trump.
That's
Okay, so figure skating for you. And how about you, Dr. Tisdale? Which one would you pick? And those are the comments. I want you to do the same thing. Put in the comments what you would pick. Go ahead.
I think I'd have to pick diving.
Oh.
And,
Okay.
It's really because I'm terrified of it. Like, I could never. My daughter is a competitive swimmer, and the first time she went to a tournament, we walked up to the pool, and the whole pool was 12 feet deep. And we have a pool at home, but we have a shallow end, obviously. And it was just this moment of, gosh, I hope this isn't one of those mommy has to show you first things, because mommy's not going to show you first. I don't do water that is over my head. So just going up to that height, every time I watch them do it and I see how deep that water is, it terrifies me. So if I could have the courage to do that, I think I not need anything else in life in terms of courage.
I think it's interesting that, okay, so DeRouen went with her favorite, and you went with something you would have to have courage that it's not your favorite at all. It's like the opposite of favorite.
Exactly.
And you're looking as a way to have your growth through. That's an interesting, I like that approach. Okay, very good. So in the comments, what would you guys pick? Now, with figure skating, what is it that draws you to figure skating? I'm curious about that, Dr. DeRouen. What about the sport really draws you in?
I think it's just a combination of ice skating. I don't ice skate well, but like I do like to ice skate in the winter, like in a circle, and just all the things they can do on those skates where I'm just kind of almost barely not holding on to the rail, in addition to all the routines and the outfits. It's just like the ambiance of it, I think.
Okay. Did you know I used to be a figure skater?
Really?
No, just kidding.
The things you learn, you're going to start a rumor.
No, just kidding. Okay, so let's go back to what I was saying. So what's an actionable item? Dr. Tisdale, do you want to start us off, and then we'll do Dr. Ron? What's the actionable item or two for either one of those things I mentioned, whether it's family practice, if it's a clinic situation, if it's a hospital? What are some things you would think that are actionable items that they can do?
I would start with, of all of the chiefs we have in every organization, a chief of physician health.
Ooh.
I think that we invest in chiefing, if you will, every other area of our industry except physician health. And I also think that it's literally funny to me when we have these conversations, people start looking, gosh, I wonder who we could ask, who could tell us what would help physicians. Goodness, who could? Physicians. So if you ask us, we will tell you what would be best for our health. And if we had a champion for that, it would make a huge difference. Chief medical officers and other executive roles that are held by physicians really are business roles. And there's a lot of work involved with that. But I don't think that person can do all of those things. I think this deserves its own champion in any system.
This is almost giving me chills, because This we may have just started something. Who knows? I'm hoping the right person watched this and they make this big announcement, and then the press picks it up, and because healthcare is a very much kind of monkey see, monkey do kind of deal, at least from what I've noticed anyway. I could be wrong, but such this hospital is doing? Okay, well, we should look at doing that too. Oh, that hospital is doing? Okay, we should look at doing it too. And then before you know it, it can get the ball rolling. What do you think, Dr. Rowan? What's your first of all, what's your take on what she just said, and then what's your tip?
I love what she just said. I think that is very important if we're going to focus on wellness, to have a person that's their daily job where they're in the trenches trying to figure out how to solve the problems. But for my answer, if we're taking a step back, while I think that our conversation went in this direction, and a lot of this is due to wellness and retention, but I think that we need to take a closer look at retention as a whole and what other factors are involved in keeping people there. And perhaps not just have one person, well, we could have one person dedicated to following through with the ideas, but kind of taking it down to the workforce and seeing what is actually out there, and not just through surveys, maybe having a working group or a committee or something like that, actually sit and study and see what is missing and have an opportunity for conversations with those people, and not just say, okay, because every organization is different. So what in our organization with our workers are the needs? So some organizations or certain clinics might have a clinic full of physician moms, and they may all say, okay, to make me feel better, I want to have Friday off every week or something so I can go to my kids' games. And they might say, okay, well, it's 5 doctors here. How about we alternate every other Friday or something like that? Whereas another clinic may say, I really want to pursue physician growth or something so that I can do this. So they'd be like, okay, let's implement some kind of physician development team. So it's just kind of seeing what the needs of the workers are, because they all may be unique.
Oh, I like that one too. That's another good one. Wow, this is an amazing show today. Okay, so Kim says, I'm not athletic at any sport. I will go with bobsledding, but no, it won't end well. Laugh out loud. Okay, she says, love chief of physician health. That's a critical role and very needed. So yeah, I think I'm just thinking, I'm running the numbers in my head. Okay, so the amount that they would pay one person to do that, I mean, it just pales in comparison to the costs involved with not addressing it. And whether it's attrition of the physicians leaving and they're having to recruit new ones, or lost time of physicians being lost from work because of health issues that could have been addressed earlier, or having to leave practice altogether because they had some reported incident. I mean, it just be a number of things. I could just see how it could really pay. So I love the idea.
And the cost, Rollis, is super important if we want to talk business about it. Again, going back and forth between languages, when you're talking with hospital leaders, you're usually talking to business people. The cost of turnover and loss of physician revenue is in the millions. So recruitment, all of those costs together clearly could easily be recouped if you had someone committed to that role and you were able to improve those metrics. Yeah. So this is not a small deal. There is value there. Yeah. And I think that it could even scale to include a lot of other things that are overlooked in terms of physician needs. So it is a costly problem, not just our health and our loss of revenue, but loss of operating revenue for every organization that loses a physician. Yeah. And also for the patients who receive that care, they then have to find a new place to go.
Yeah. I definitely think there is there. Mm-hmm. Sometimes I'll say there's no there, but there is there with that. Okay, Dr. DeRouen, I love the idea too, what you said earlier. I know some places do it, some places don't. I just want to talk about this whole stress that comes from the EMR and how some have said we'll do a scribe, some say no, we won't do a scribe. Give me your take on it. What are some things? Because that has definitely affected physicians. I know for a fact. I've talked to several. So what are your thoughts on that?
EMRs are very important because we have to be realistic in these times. That is where physicians are spending more and more of their time. And figuring out ones that are efficient and helping you get through notes and have all of those types of things built in, whether or not they have the automated systems like a Dragon where they can do dictations versus having a scribe. And there are different models for each. And I honestly don't have the numbers, but I have talked to several friends who have had scribes. And there's just kind of a sense of relief at the end of the visit because you don't have to go back and rethink about what you said and document and spend another hour after you already spent an hour with them. So I think that would definitely help on that work-life balance where you have your notes done, you know that they're accurate because you just did them on the spot. And then that'll help, I guess, from the business mind too, because a lot of times when physicians and other healthcare providers in the system don't have that time and they're always on that rush like we talked about, it may take them a few days to do their notes. And then that kind of comes into play with reimbursement and the dealings with the administration about get your notes done and all of those kind of things. So it can help with a lot of things.
And I would think memory is not perfect. We're not perfect human beings. So 2 or 3 days later, you might not remember everything.
Exactly.
Wow. That is okay. So one of the things I was thinking about, and I've been using this recently, and it's called it's AI. And it will transcribe all my meetings. So I do a lot of Zoom meetings, and it transcribes them, but it's not 100% accurate. And you don't want to have this thing, end up misdiagnosing somebody or having the wrong stuff in there because the AI didn't catch it right. So I don't think we're at a point to just totally rely on AI. But what are your thoughts about maybe having the scribe review the notes later, maybe not live in the room, but they could just take they take the recording and automatically transcribe it, and then maybe the scribe review. Have you heard anything like that, or do you think it just should be just a person?
Well, so typically, I'm not sure if you wanted either of us to answer, but
Feel free.
typically,
Go ahead. It's for anybody.
Okay. Typically with scribes or dictation services, we're still responsible for proofreading the note before we ultimately sign and submit it. And I think that sense of relief is that we don't have to go through and physically manually type so much information. And specifically to Dr. DeRouen's segment of medicine, primary care physicians, one of the number one dissatisfiers is the EMR, because it leads to overwhelming quantities of uncompensated work that they have to take home with them, that interferes with family life and ultimately is not sustainable. So I think that if we were less responsible with a scribe, typing in every little box and hitting every little portion of the chart that needs to be hit so that insurance companies can get all of the information that they need, we would be better able to look at the note in its totality and say, okay, everything's here. Oh, I've got to correct that word. We can do that, sign and move on. You can get the same work done in a quarter of the time it would spend you without a scribe if you have a scribe. And I think that we ultimately want to be responsible for our work product and our notes, and we are, but it's the tedious nature with which we have to complete them that I think we need relief from.
So it is possible that AI could perhaps help then.
Absolutely.
Yes, I think that AI is the future, is going to happen eventually, even if we can't imagine it right now. And like Dr. Tisdale said, when your notes are your responsibility, is your medical license, so you're going to have to proofread. There are lots of fun times with certain dictations and things where people will sit around and read all of the mistakes that it makes and the different things. So it's very common, but you just have to fix it. But I do definitely think that it can help with some of the burnout. Just for full disclosure, 3 of my friends in the past 2 months have resigned from their jobs because they've been overwhelmed with the EMR.
Yeah. That's why this conversation is really needed, and it's interesting to me. I'm saying interesting to make it nice, but it just seems that we talk about talent acquisition, bringing folks in, but I don't know that as an industry we've been particularly good about the back door, and just locking that thing up as best we can. You can't totally lock it. In fact, some attrition is actually good. But really asking the questions and then willing to actually do the work to fix those issues is something I haven't seen in abundance. So I'm not complaining, guys who watch this. I'm not complaining. I'm just making an observation that I think that if perhaps some of these things you're talking about, where we're asking the physicians, we're asking the other folks, the nurses, the nurse practitioners, everyone, and even down to the medical assistants. I hear medical assistants, look, we don't get any kind of due either. I've heard them say that too. But asking them and actually implementing what they're saying actually costs less than a lot of these other things. I don't know I keep going to cost, but I know if I don't speak the cost language, an administrator's not going to hear me.
Right.
But when you compare those two, it actually costs less than the issue of all the other things that happen when you don't do those things.
Absolutely.
I absolutely agree. And the reason I actually stood up for a moment, I went and got this book because I think that it all kind of boils down to engagement. And I've been reading this book called Engagement Magic, 5 Keys for Engaging People, Leaders, and Organizations.
Okay.
And it actually kind of dives deeply into when you have an engaged group, they work harder, they work smarter, they want to contribute, they want to stay, and your business actually does better. So it's kind of just figuring out those ways in which they want to be engaged. So the things like we talked about, wellness, health, development, growth, purpose, Like they all kind of come into play, and you just have to figure out ways in which to kind of help them follow through without making empty promises. And also, keeping in alignment with your organizational goals. But there's a way to marry the two.
Yes, it makes so much sense. And like I've said many times before, the answers are in the test, are given for the test. I mean, all we have to do is ask them. I mean, if I want to know why nurses are leaving, or in this case, why physicians are leaving, I can just ask them. And if I don't have any there that I can talk to, I can go on YouTube and probably watch 20 videos that tell me exactly. Well, because I've watched several of those videos, by the way. They're like, I call them exit interviews, where they tell you these are the reasons why I left, and they just go boom, 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 boom. So anyway, yeah, this has been incredibly enlightening. Okay, I want to do one more fun question. I have to. Okay. Now I kind of want to ask you guys. Even though I asked this yesterday, I usually don't ask the same questions in the same week, but I kind of want to ask you guys this. I'm really tempted to ask this one instead of doing a different one. What do you guys think? You think I should give you a new one?
Surprise us. Either way, we will be surprised.
Okay,
I don't know what the question was.
That's true.
Exactly.
That's
So
true.
it's okay.
Okay.
Whatever works for you.
All right. So, okay, we'll do this one. And this is not. We're not talking about anything having to do with your practice. Okay. This is like outside of work. Okay. So I want you to answer this question truthfully. Never have I ever. Either you have or you've never. And what we're gonna do is we're gonna guess for Dr. Tisdale. And then Dr. DeRouen, you're going to answer for yourself right away. But we're both going to guess for Dr. Tisdale. And the second question, we'll do it vice versa, okay? All right. Never have I ever texted the wrong person.
I have.
You have, okay. And I have too. Okay, now do we think that Dr. Tisdale has ever texted the wrong person? By the way, in the comments, tell us if you've ever texted the wrong person or not. Do we think that Dr. Tisdale has ever texted the wrong person? She's gonna, Dr. Rowan thinks so. I'm gonna go. You know what? Part of me thinks no, that you double check and triple check. Part of me thinks that, but I just feel like I got to go with Dr. DeRouen on this one. So I'm just gonna go with her on this one. I'm kind of leaning towards her. Yeah, I'm kind of leaning towards intuition. So is it? So have you or have you never texted the wrong person?
Yes, I have. Despite my double and triple checking, sir, I have made that mistake. Absolutely have.
It's just way less than me. He's done it once.
Exactly.
That's it.
Exactly. Okay, here's my last one. This will finish us out. So never have I ever, and then this we're going to guess on Dr. DeRouen, Dr. Tisdale. Never have I ever made a video of myself singing or dancing.
I have not made a video of myself singing or dancing.
Okay, now what do we think about Dr. DeRouen?
I'm gonna go with yes. She's spirited. She has that spirit of, oh my gosh, I want to do this and I think it's fun. I see it happening. She's an Instagram warrior, a professional.
Yes.
She knows social media up and down. They're the experts.
100%. I agree. I think yes. So tell us, is it true or not?
That's a trick question. I mean, like, I haven't done like a TikTok or like just me, maybe.
It just says made a video of yourself singing or dancing.
Not on purpose.
Okay, well, guys, this was amazing today. This was literally, I mean, this was amazing. So anyway, you guys, I got to give you this. See, if I had a crowd, they'd be doing this for you right here.
Thank you.
Yeah, that was amazing. Joanne, can you invite the other folks in? I want them to at least say hi to each other. So can we invite the other folks in now? Let's go ahead and bring them into this group here. Let's have them do that. Just so that I can say hello as they come in, and hopefully they can hear me. Yeah, Joanne, please, let's make sure that either yourself or Jonathan brings them in. Bring them into this room here. In fact, I'm going to. Hit the little sign button there. There we go. There's John Koch.
Hello. Hi.
Did I say that right? Is it Koch?
Yes, sir.
Okay, and we have Susie Loredo. Welcome.
Thank you.
And we
Glad to
have
be
Miss
here.
Kim LaMontagne. Thank you.
Oh, welcome.
So this is the person, Dr. Tisdale and Dr. DeRouen, that was commenting quite a bit. Kim.
Yeah, that was
Nice
me.
to see your face.
Yeah.
I'm sure that you guys will have a great session.
Yes.
Yes, absolutely. So thank you, Dr. Tisdale. Thank you, Dr. DeRouen. You guys did great. So we're going to say bye to you for now. I'm going to definitely invite you guys back. But thank you so much.
Bye. Thank you for having us.
Okay, folks, so this has been a great show so far, and we have more for you. We have 3 great guests. We're going to be talking about how we can address things from the mental health aspect of our employees, what resources we can provide. And then also we're going to talk about, addiction issues, because I think this is something that's lacking, is that sometimes employers, facilities, they're not able to see that there may be some potential issues and how they may be able to help some of those employees. So I've got a great panel here with us today. I want to thank all of you for being here, and I want to welcome you individually to the show. So I see at my top left-hand corner, I have Mr. John Koch. He's from the Community Medical Services. Welcome to the show.
Thank you, Ross.
And then also I have Ms. Kim LaMontagne, my top right-hand corner. She is a national speaker on the topic of mental health, and I want to welcome you to the show, Kim.
Thank you, Rollis. It's always a pleasure to be here with you.
Thank you. And if for anyone who's watched several of my shows, you may have seen Kim on one of my shows because she's been on several. And I want to also welcome Miss Susie Loredo from Legacy Community Health, who's here with us today as well. Thank you for being here.
Thanks so much for having me. I appreciate it.
Yeah, absolutely. And it's wonderful that your organizations allowed you to be here and to join us as well. So I want to thank really everyone who was involved for having you here. So thank you. So getting into this subject, this is kind of a tough subject, but it's the one I wanted to address. And as we mentioned some of the issues that come up, I want us to have solutions too. So that's why I'm happy to have each of you here, because I do think you have some solutions. You do have some resources that will help employers as well as employees with some of these issues. So let's start with you, John. If you can, briefly give us a little bit of a scope of things that are available within your the services that you provide, so we can have an idea, because some of these things I just wasn't aware that was available. So go ahead and tell us, please.
So I work for an opioid treatment program, which we specifically aim at helping those with opioid use disorder, or what you will hear sometimes as OUD. And often with the workplace, so I'll give you a little history on me. I'm a person in long-term recovery from opioid use disorder. When I first got introduced to the field, I had worked several jobs and found a passion in working with other people and trying to make a difference nationwide when it comes to those who experience stigma around their job title, around having used drugs in the past, so on and so forth. So I really want to make an effort to break that stigma, and the company I work with has made an awesome job. Is that I started off as a peer support specialist, which is usually somebody in live recovery, and it's the baseline job that you would start in a company. Now today, through my company supporting me, Community Medical Services, and especially our CEO, Nick Stavros, and our COO and CFO, they've all helped me to climb and learn in my career, which now I'm the Director of Community Relations for Community Medical Services. So that has put me in a better position for my family and gave me an opportunity that without the faith of other people getting behind me and having my back, I would not have the opportunity to do today. So
I love that. I love that story. In fact, I think that deserves this right here. That's a great story you just shared with us. I appreciate that. Wow. Okay, now Kim, tell us a little bit about your background. I know your background, but I want to make sure our audience does. What you've been up to.
Sure, absolutely. So as you mentioned, I'm a speaker, a teacher, and a trainer. My focus is on mental health in the workplace. And I too am 12 years in recovery. I am 12 years sober from alcohol and several years free of suicidal thoughts, depression, and anxiety. And I suffered in the workplace as a high-performing corporate professional, and no one knew that I was living behind that mask of high performance with all of those issues behind me. I am now sober, healthy. I left the corporate world last year on April 1 to follow my passion, and I created my own company, LaMontagne LLC, and I now teach leaders in the workplace how to create and sustain a mentally healthy workplace culture where everyone feels safe speaking openly without fear of retribution, judgment, or job loss.
Thank you. I really appreciate you sharing your story and being with us and being so open about it. It helps all of us. And then I'm very excited to have someone who's from the therapist side with us to give her knowledge and her expertise. And so I'm very excited to have you, Susie, if you could kind of give us a little bit about your background as well.
So I am a licensed clinical social worker and a psychotherapist at Legacy Community Health in Houston. And we started in 2018, we started a program called our Addiction Recovery Social Work Program. And what that does is it's specifically focused for our patients whose providers might believe that they have a substance use disorder of some kind. And so I work with them I work with our patients to help move them towards recovery, move them towards being open for treatment, move them through their stages of change so that they can access the proper treatment that would be the most beneficial to them.
Awesome. Well, I know we're going to get some great nuggets out of this session because I've got varied backgrounds here. You're able to see things through different lenses, and so as we look through that lens of, let's just say, addiction, since I think that's where all three of you kind of have that background. What are some of the warning signs that perhaps an employer can notice perhaps in an employee that will help to offer the resources that can help that particular employee? Who would like to take that one first?
I'd be happy to.
Go for it, Kim.
So I think every employee will show different signs and symptoms. For me, for instance, I was a chameleon in the workplace and no one saw any of my signs because I kept them so well hidden. But your typical signs to look for might be changes in physical appearance, sleep habits, tardiness, weight gain, weight loss, frustration, aggravation, isolation, withdrawal. And we're living in a remote society right now, so many of us as employees, we can hide behind technology. Are your employees showing up or are they canceling meetings? Are they meeting deadlines? Are their work habits changing where, like me, they are a trailblazer and a leader and maybe they pull back a little bit and their out of the box ideas are slowing down? Something that is so small and minuscule could be an incredibly important sign for you to be able to identify. And the key is that leaders in organizations must feel confident not to become counselors, because we do not want leaders to become counselors in the workplace, but they need to have confidence that starting a conversation with an employee about mental health and well-being or signs and symptoms that they're seeing is just as important as talking with someone about signs and symptoms that their blood pressure might be off the charts, that they might need to have a checkup because they're noticing some physical issues within that employee. So again, it's knowing the signs, but then also feeling empowered to be able to reach out to that employee to say, I see you and I want to support you. I'm not your final answer. I'm going to get you to the right services, but I'm a safe place for you to speak openly.
Appreciate that. Susie, how about from your lens? How do you see this? Because I know you've got a different vantage point here.
Well, one thing that I like about having our addiction recovery social work program at Legacy is that it's a sign that we are open to talking about substance use issues, that we are open to helping find solutions to those issues, and that we're not going to get caught up in the stigma of substance use, which is really debilitating to a lot of people. The shame and stigma around it is a huge barrier to care. And so knowing that this program exists, so I'm not specifically employed to work with employees, but I do work with employees. And so just knowing that I'm there is, I think it just decreases the stigma around substance use disorders.
Wow, that's powerful. I love that. So, okay, so you're in this program, you're bringing in patients from the community, but if an employee has these types of needs, they can approach and use your services as well.
Mm-hmm. Yes.
Wow.
And we are encouraged to go through our EAP, if we have any issues, but sometimes people are like, I don't even know, how do I contact my EAP? I don't even know what to do. And so I can kind of get them started down the path in the right direction.
Wow, that is powerful. That it's just how do you feel? Okay, I'm trying, because this doesn't sound common. This doesn't sound like a lot of places have this, where just any employee can use this beyond. Because I'll hear EAP a lot. I'll talk to a lot of health systems. I don't know of one who said what you just said. So maybe is this something that you think more organizations should take advantage of, and how could they get started with something like this?
Well, honestly, I don't know how another agency would get started, but we went through the process of having a grant and getting it funded through that. And so we had a motivated structure hierarchy within Legacy that was interested in starting this program. And so, if you have the powers that be who want to do something, then it can happen, right?
Yeah, I think you hit the nail on the head, because the leadership obviously sees the need for it, and they made it available. Because if they weren't excited about it, you probably wouldn't have one right now.
Right. And, a lot of times, I would say more often than not, I am helping employees with their family members who are struggling with substance use disorders. And so because that takes a huge emotional toll on our colleagues. And
Absolutely.
so if I can help someone get their mom or their child or their husband or spouse or whatever into treatment, or even if they won't go into treatment, if I can help them access supportive services for their own, like Al-Anon or a friends and family type of program, that is hugely beneficial to that employee.
And so what I want to do, Susie, is I want to come back to you after I spoke with John for a minute. I want to come back to you and ask you about what is language that we should use, that is supportive language to family members, perhaps who may need to get some help, or maybe you can just give us some ideas on that, because that's where I just would not know where to go next in terms of language. How do you communicate that? But John, I want to get your thoughts on this. So we've talked about this for a few minutes here. What are some signs that employers could look out for that may be a somewhat of a clue that this person may have an issue with opiates?
Yeah. First, I want to say every person, as kind of the first two people have said, is different. So you're going to have your individuals that just stop coming to work. You're going to have your individuals who show up on time and leave on time, and they may walk out during work. You never know. For myself, signs were that one, I was just no longer wanted to show up to work on time because things became more important to get there. But then also, when you're speaking about the physical effects of somebody, we have to keep in mind too, where like that is a very tell-all with some of this, but then also some things, times people can be going through a different position. So like recently, I got diagnosed with a stomach disorder. It caused me to lose over 30 pounds. A lot of people were like, "Hey, John, are you okay? Are you okay?" And where I appreciated what people were saying, "Are you okay? Are you okay?" At the same time, it was, "Can you just ask me, or what is the reason why you're asking me, am I okay?" So there's a lot of, sometimes people feel stigma by questions that are aimed at them, because it's like, do you ask this to another employee that you know doesn't have a history? So just a person-centered language, how you can meet that person where they're at. I'm big on that. And communication, loving, empathy, caring. If you come at people in the wrong way, they're going to back away.
Woo, boy, that was powerful right there. I never thought about that.
Language,
What are you going to say that, Kim? I couldn't hear you. Go ahead.
Our language matters, and the way we speak to people and support people absolutely matters. They're powerful.
Yes. Okay, so I'm gonna come back to that too about the language. And so, Susie, do you have any thought? We're obviously we're not going to be a therapist or a psychotherapist or a counselor. We don't mean to take that role, but at least just give us a little bit of a way that we could communicate to someone where there's not the stigma attached, that maybe they do need to get some help, or what things do we need to look at before we have that conversation.
I try to always use person-centered language and non-stigmatizing language when I'm talking with people. So first of all, I've given presentations to our medical teams and things about how to use person-centered, non-stigmatizing language, because there's been a lot of research in the recovery field about how stigmatizing language is a huge barrier to care. And if a doctor in a primary care setting or in any medical setting uses stigmatizing language, those patients are less likely to access care. So, we do not use the words like addict and alcoholic and druggie and pee clean, pee dirty. We do not use those at all. We use, person with a substance use disorder, person with an alcohol use disorder, person with an opioid use disorder. We are specific. And if someone is positive on a urinary drug screen, that's the language we use. You are positive for this particular substance on a UDS. So it's very intentional. You have to be really intentional. And sometimes it's clumsy, right? It's like saying person with a substance use disorder is it's a lot more words than saying druggie or alcoholic. It can feel clunky at first, but it makes a huge difference when you're talking with people, and it just makes it more like clinical and routine, frankly. And
Yes.
So I will use words like, if I'm talking with someone about they may be struggling with their use of a particular substance. So we talk about it in that way. And also we talk about it in a positive way, that lots of people are in recovery from substance use disorders. And that is an achievable goal if that is what you're interested in.
Oh, I love that. This is great. And to me, what else it made me think of when you were saying it? Humane.
Yes.
It just makes it more humane, and it gives more human feeling than giving someone a label. And I know, Kim, you talked about this in the past. I know you've got some thoughts, and I could see your agreement. So go ahead and add your points too to that, Kim.
Oh gosh, I could speak forever on this because this is one of my most favorite things to teach, the power of language. But words absolutely matter. And I'll take you through a quick exercise. You were just, Susie was talking about, patients gaining access to treatment. Well, think of being in an office, and I may have done this exercise with you before, Rollis, but being in an office pre-COVID, and it's Monday morning, we're standing around the water cooler, and one of our coworkers, John Doe, who is a psycho-crazy drug addict, alcoholic, who just checked himself into the loony bin because he went off his rocker, and everybody's going to stigmatize him. If we're talking about that water, around that water cooler, around him using that type of language, and if I'm sitting there in that conversation knowing that I too have an undisclosed substance use disorder or mental illness, I will never speak openly. However, if the language is changed to, wow, John Doe, I had no idea that he was living with substance use, with substance misuse. I had no idea that he was struggling with such debilitating depression and suicidal thoughts, so much that he felt compelled to seek the treatment that he sought. And I am so proud of him for getting the treatment that he needs, and I'm going to support him as he goes through his program. And when he comes back, I'm going to make sure that he knows that he's safe, seen, heard, and supported in this workplace, because he's a person and he matters. I may have the courage and the strength to come forward and say, I'm just like John. I mean, I used to call myself an alcoholic. I no longer do. And if somebody uses that word, it kind of stirs up my stomach kind of feels funny, but I don't blame anyone, because until you know that is a stigmatizing word, you don't know. But I no longer, I welcome, if someone uses that word, I say, I invite you to consider me as a person who lives with alcohol misuse. And it really totally changes the way people look at us. And I just moderated a CEO Roundtable last Monday up in Manchester, New Hampshire, virtually. And I talked about changing the language around suicide, because many of us are still using the words committed suicide, when in all actuality, it's people who are dying by suicide. They're not committing an act. They are dying by their final symptom of mental illness. Now, if someone had a heart attack, it's their final symptom of heart disease. They're not committing that heart attack. They are dying by that heart attack. It's the same thing with suicide. So changing the perception, getting rid of that stigma, saying someone died by suicide, that was their final symptom, versus saying that they did this to them. Because remember, Rollis, I have been there. I had the means, I had the plan, I had it all planned out. I know what the darkness feels like, and it would have been my final symptom had I gone through with the plan that I had to end my life.
Wow, that's
Words
powerful.
matter. Language matters.
That is powerful. I have to do this because it's moving. It really is. Yeah.
That's why I'm passionate about my work.
Yeah, absolutely. Okay, so what we're gonna do now, you guys, if you guys have ever seen my show, we're not gonna stay there. We're gonna do a little bit of fun, then we're gonna come back to the subject. Okay, is that all right? Okay, because I think laughter is a healer too. I love laughter. If we can laugh together, we can heal together. You know. Okay, so this is a would you rather question. Who wants to take this one? Who feels brave? You're gonna make one of two choices.
Throw it out there.
Okay, so John wants to do it.
I've done these shows before, so I think they should take it.
Okay, so John, you'll take it first, and everybody else will answer. Okay, but you're gonna take it first.
Okay.
All right, so, would you rather? This is a tough one. Would you rather be on top of a Ferris wheel during an earthquake, or on a Ferris wheel during an electrical storm?
Oh my gosh.
Oh.
That's a tough one. Now, assuming you're going to live through either, okay? You're going to go through it undamaged, but I'm just saying, okay?
Then Well, I got to go with the earthquake because I think it's going to throw in some extra moves in there as we're going along. And lightning is scary.
Okay. I like how you not only told me your choice, but you told me why. So I appreciate that. Okay, so Susie, which one are you going to go with?
Oh my goodness. Probably lightning, I guess.
Lightning. Okay, why'd you pick lightning?
Well, because there's a very slim chance you actually get struck by lightning, I guess. I've never been struck by lightning, so I'm going to go with that.
Okay, all right.
Earthquakes are terrifying for me.
And guys in the comments, let me know which one you would go with. And Kim, let me know which one you would go with. Would you go with being on top of a Ferris wheel during an earthquake or during an electrical storm?
I would have to say the earthquake. Not that I'm a fan of either, but I think it's quite dangerous to be at the very top of a metal object that is big and shiny during an electrical storm versus an earthquake. And maybe if I fall from the earthquake, there'll be some padding underneath me. I don't know. That's a tough one.
I think I'm with Susie on this one. The reason why I'm with you on this one, Susie, is because I'm hoping that even though I'm on top of this Ferris wheel, that the electrical storm or the lightning doesn't hit the actual Ferris wheel. I'm just hoping it's going to hit somewhere, and maybe in the vicinity, but not where I'm at. Is that what you're thinking, Susie?
Yeah, maybe there's somebody playing golf nearby and they can, standing under a lone tree, holding up a golf club or something,
Right. Okay, so that helps us out. Okay, so a little mental exercise. We got a little free there. Let's go back to. I want to go back to base level of what an employer should provide. So, and you can look at it just as an employee. Just what do you think? What do you think base level an employer should provide? Because these are some pretty, it's a pretty deep subject. And I know when you get to work, people are busy doing all these different tasks. They may not be paying close attention to each other and all those. But what's base level of what we should be paying attention to? John, you want to start us off with that one? Just your opinion. There's no right or wrong answers. Just curious. What's base level?
So when you're saying what we should be paying attention to, is it with the individual person?
Well, yeah, just with coworkers, employees, people who we work with, because we cover a lot of things. How things are. This person's different. They've changed their weight, or this person not turning in their reports on time, or whatever the case is. What's base level, in your opinion, that we should be paying attention to?
Saying that 95% of people with an addiction do not even recognize or will admit to having that addiction due to stigma. What we should recognize is maybe what in ourselves where we can maybe help them or help to guide them to something that would better their lives when it comes to this situation.
Okay.
That would be how I'm looking at it.
How about you, Kim? What do you think?
I would say baseline is that leaders, top tier leaders, need to make a commitment to make their workplace a stigma-free and a discrimination-free workplace, and arm their leaders with the right resources to be able to feel confident that they can have conversations, navigate those conversations, and crosswalk their employees to the right resources. When I did my MBA capstone project on leadership-driven mental health campaigns, I did research on employee assistance programs, and about 75% of medium to large organizations offer them, but the national usage rate is 3.5% to 5%.
Ooh.
Baseline is bringing that employee assistance program out of the bottom of the HR book, bringing it to the top of all employee communications, and encouraging, more so empowering employees to pick up that phone and use that service. So baseline is letting people know that there are resources available, arming your leaders with those access to those resources, and then empowering your leaders by educating them on how to spot the signs and symptoms, how to start that conversation, and how to get that employee in a judgment-free, confidential way over to the right services so that that person can heal, get better, and return to work as a more healthy and engaged employee.
That's powerful. Okay, Susie, what do you think? What do you think baseline is?
I feel like baseline is anyone who manages people needs to be a person who their employees are able to come to and talk humanely and openly about what's going on in their lives. If we want to humanize work, we need to have supervisors, managers, all the people who are managing people be trained in how to become a person who other people want to come and talk to, and are able to come and really talk about what's happening in their lives, because we want to be able to come to work as our whole selves, not as some made up version of ourselves. So I think having managers who are, they're kind of the front line, right? I mean,
Yeah.
Until so having managers who are who their employees are able to talk to, I think is hugely important.
Yeah. That's a wonder. No, that is absolutely, I agree 100% with that. And in a lot of cases, in a lot of organizations, the best personal producers are the ones that are promoted to management in a lot of different areas. If you're a really, really good nurse, you become a nurse manager. If you're really, really good at being a physician, you become a director. If you're really, really good at, call center or something, you become like the manager. But they don't necessarily have a lot of training, I don't think, in what you're mentioning.
Mm-hmm.
So if that's baseline, that's actually I'm not going to say it's out of reach, but it's definitely a high bar for a lot of companies to reach. So this brings up a very interesting thing about training. I know, Kim, you got some stuff on that.
I do. I wrote an entire corporate curriculum called The 4 Pillars of Creating and Sustaining a Mentally Healthy Workplace Culture. And it teaches leaders about the power of peer support, the power of language, how to eliminate stigma and discrimination. I bring up and introduce concepts called presenteeism and label avoidance. If you're not familiar with label avoidance, very dangerous. It is the concept that people do not seek treatment for mental health or substance misuse because they do not want to be assigned a stigmatizing label. That right there is dangerous. And I teach leaders to not be afraid of these things. And I just recently wrote a blog, actually, Susie, to your point. I had a leader in 2016. See, I've been sober since 2009, but struggled massively between 2009 and 2016 with the depression and the suicidal thoughts. She noticed, she was the only person who noticed that something was off with me. She took a trip from Newark, New Jersey up to Boston because I was working remotely. And we spent the day together in April of 2016. And she said, "What is really going on with you, Kim?" And I shared it all. She was stunned and blown away. And she cried and we hugged. And it was an amazing day. And she said, "How in the world have you been performing at the level that you've been performing with all this going on in the background?" I said, "I don't know. I just put on that mask of high performance and I did it." Mm-hmm. But because of that conversation, she let me be who I was. And she told me to take extra time off around Memorial Day weekend to get myself healthier. So she gave me a couple of extra days, which led me to a retreat center in upstate New York, where I saw a presenter and a teacher who changed my life. And the weekend of Memorial Day weekend 2016, my light finally came back on. Had I not had that conversation with my leader, I never would have taken that extra time. I never would have gone to that retreat, and I could still be swirling around. But I commend her and I give her credit for seeing the subtle signs, because again, I thought my signs were so incredibly noticeable, but they weren't. Mm-hmm. But I give her credit. She gave me that safe space to have the conversation. And now I teach other leaders to do the same thing. It's powerful.
Yeah, I have to say, because I've never, I was, in my case, I was the best. I'm not gonna say I was the best, but I was one of the top recruiters in my organization that I worked for, and they promoted me to manager and director. But I had no training about this stuff. It was a small company. I wouldn't have expected that they would have even had that kind of training, because especially back then, that was many years ago. So I'm wondering, because you guys are bringing up some great points here. The program you have, Kim, is that something that trains these leaders how to do that? Because
It does.
Okay.
It absolutely does. It's a full day program, live in person, virtually on Zoom, or on demand to meet anyone's schedule. And I go through the 4 pillars. I talk about the statistics of unaddressed mental illness, the business case to address it, the power of peer support. I stood up in front of all my coworkers in 2017, 35, 40 of them, and I shared my truth. I spoke my truth at a corporate sales meeting, and 8 of my own coworkers said, me too. They stepped forward. So it's about bringing the peer support. It's about teaching leaders how to change their language to help decrease the stigma, and how to embed their commitment into all their communications. So yes, that's exactly what I do, and that's exactly how I prepare leaders to change the culture.
Well, we thank you. I'm glad you're providing a valuable service in doing that. So, John, let me ask you this. What is it that helped you to turn things around? I mean, you talked about how you were going through this situation in life where you were suffering from this addiction to the opiates. How were you able to overcome that?
By some people showing me some love was the main thing. One thing I would say is that addiction, substance use disorder, addiction, alcoholism, all of those different pieces, they have no face. So when you look at me, I am a kid that grew up in Chicago, had a mother and father who cared about him, worked hard in life. I never imagined that addiction was going to take all that from me, right? So now when I go back into the workplace, when I noticed it, I was homeless. I had nothing, and I didn't think I was worth anything. And some people started to show me that I had worth. And that's when it really started to connect, and I got into treatment at the time. But, I think a lot of it too stems back to the policies and procedures that are inside of our companies that allow for people to be, if they allow for people to be open and honest, or they allow for people to hide what they're feeling, because there is some companies that do that. But the big thing was love. When you see somebody that's struggling with something, help them to go up to them and say, get your stuff together.
Yeah.
They want that more than you want it for them. So.
Okay. Now, Susie, this brings me to ask you this question. So how important is a support system when you're working with a patient? Is it important? Is it more about the person themselves? Is it a support system? Is it a combination of both? Which things are you, when you're looking at a situation when you're working with someone and helping them, what are some signs for you that there's a good chance this is going to work out? Wow, this is going to be tough.
Well, in the recovery community, we say that we recover in community. And so who is around you is incredibly important. So, what I talk to my patients about is find your people, find your tribe you're all working towards the same goal. And people who are all focused on the same goal, when you all work together, it is incredibly, incredibly powerful. And so, that's why there are so many, self-help groups and recovery communities. That's why, those are a powerful resource for people. It's not, and some people can recover just through, having that community. Other people need more formal treatment programs, but you have to have your community. You have to have your tribe who you're going through this with, for sure.
And I have one follow up too, because I just got off of a very moving episode before you guys, and I never thought about this before, but they talked about no one talks about doctors' health, physicians' health. No one talks about that. I've been around this business a long time, 16, 17 years. I've never heard anybody say that, and so it really I got actually a little emotional when they were talking about it. But now I got to ask the question for you, Susie. Do you feel like that's an issue in the therapist community, because therapists may need therapists too? I mean, I don't know. I'm talking to you. I mean, do you see that in the community where that's an issue, like with the doctors? I don't know. I'm just asking.
Of course. I mean, burnout is incredibly common in all helping professions, right? And so I would assume, I hope all therapists also have a therapist. Not sure I would trust a therapist who doesn't have a therapist.
Okay. So it's accepted, huh? There's no stigma there.
Oh,
apparently.
no. I mean, you can't, that would be sort of, it would be funny to be telling your patient something and you not taking your own advice, I guess. So yeah, but I do also think it's interesting. You're talking about doctors and, burnout and not getting support services. I think that is a real issue. I come from the social work world. We talk about, burnout all the time. That is and self-care and, how we can just sort of help ourselves manage the things that we see day to day. It's because it's hard, right? We all do really hard work. Anybody who's in the helping profession it's very difficult. And so, and self-care isn't just like, oh, I'm going to get a massage and get a pedi, whatever,
Right, exactly, yeah.
That's not what I'm talking about with self-care. It's much more involved of truly like doing deep work, working with a therapist, working with a support group. There are support groups for therapists. There are support groups for, doctors and lawyers. And, so it's important to reach out and do that, because as I said, we recover in community with others. That's where we
absolutely
really get healthy.
Kim Ali, who was on my show yesterday, she brought up a point to me and I never thought about it. She says, energy, you can't destroy it. You can only just transfer it and move it to another place. So if you got some bad stuff going on and you just say, well, I'm just going to move from this place and go over to this place. I'm going to go from this facility, go to that facility, and don't deal with it. It doesn't just go away. You've just basically brought it with you. So, Kim, what would you say to that?
I would agree with Susie on a couple of things. Number one, community. When I first got sober, I remember thinking that, you have to be homeless and living under a bridge to have a problem with alcohol. That's what I thought. Here I was, a high performer, a wife, a mom, I own a home, 2 cars. I'm not any of those things. The first night that I walked into my AA meeting, I went to Alcoholics Anonymous, which I wish they would really change that name. But
yes, based on what y'all just said, of course.
Right?
I
It should
agree.
be people Anonymous. But anyway, the first night I walked in, I went to a women's group. I was blown away. There were women in that group with PhDs. There were master's prepared engineers in that group, women. There were grandmothers. There were teachers from my daughter's school in that group. They were all people. They were all there for the same reason, to support each other and help each other get through. And none of us were unemployed, homeless, and on our last dime. We were there because we were investing in ourselves. So that's one thing that I wanted to mention. The other thing that I wanted to mention too is some other groups that I'm actually working with that we can't exclude is I'm doing some really great work with the State Department Division of Safety, which oversees state police, fire, EMS, 911, DMV. Officers, firefighters are dying by suicide. they are exposed to horrific things on a regular basis. They are experiencing PTSD. And many of the state agencies are really looking towards programs to help eliminate the stigma, because many people in that field are men. Men often have a more difficult time coming forward, especially a man who wears a uniform. Another group that's also made a huge pledge to decreasing stigma is the American Bar Association. They have an ABA pledge to eliminate stigma in the workplace. So nurses, physicians, absolutely, their mental health matters. Everyone's mental health matters. But I don't think that there's an industry out there that you can look at that is not touched by mental health and well-being in the workplace. So it really goes across everyone, but community is huge. And when you decide to enter into recovery, your community, your circle will change. Because the people you hung around with before may not be the right energy for you anymore.
Right.
And that's okay. It's a shock in the very beginning, but the new circle that you acquire, not saying that your old circle is bad, but the new circle that you acquire and that you gravitate towards will bring you so much more joy and gratitude and support, because they are seeing you for who you are and supporting you throughout the process.
Makes sense, because that crowd you were with may not be ready to make their changes yet, and if you're hanging around with them, they may just pull you right back in. Whereas if you get the new group, at least you got a fresh start. I don't know. That's why I see it.
Absolutely. In adolescent treatment, that there are formal groups that are called alternative peer groups, and those are formal groups for adolescents to join, because their normal peer group are not healthy or not a safe space for them. And so I tell even my adult patients, I'm like, you need an alternative peer group. Just, you need to find a new set of people who are motivated in the same way that you are.
Makes sense. Makes 100% sense. Okay.
Dovetail on that. When you're experiencing, addiction issues or mental health challenges, I know for me, I felt like I was the only one. I felt like I was all alone. Like everyone else around me had their stuff together. I was the only one. But when you're with a group of like-minded people who are going through the same thing, it's amazing the support that you get. And when you start speaking openly about your own story, it's amazing how many people come forward.
Yes. Yes.
I just had a deputy chief of a fire department. I told him my story, and he said, I'm right there with you. I'm in recovery too, almost 12 years. We're almost on the same path. People like us who are willing to be vulnerable, we are safe spaces for others. We're not the counselors. I always say I'm not a counselor. I have that lived experience. And I can tell you what worked for me. But what didn't work was not talking about it. What didn't work was isolation.
Right.
What didn't work is thinking that I was alone and that I was broken, because I'm not. No one is.
Appreciate that. Okay, now before I forget, I have to mention this because I saw Susie's profile picture and she had a cute little dog with her. And Leah has a dog that looks very similar to your dog.
Oh, really?
Yes, Leah's the president of our company.
That's sweet.
We're a dog.
My dog's name is Happy.
Happy.
She's precious.
Awesome. Hers is Brutus. Hers name is. He's a very small dog, but he acts like he's a Brutus though.
That's hilarious. I love it.
Okay. So we're going to do a little bit of fun, and then I'm going to have you guys finish this out with your best tips for anyone who you want to, whether you're going to speak to someone who maybe experiencing it, some type of issues right now, or they have family, or maybe employers, because I do want to help employers. Okay. So whatever you want to share, you'll be able to share that after we do this fun question. Okay. You ready? Okay. I'm going to go with, I'm going to go with Susie first, because I don't think you haven't done one yet. Have you, Susie? Not first anyway.
Yeah, no.
Okay. Okay, this is a never have I ever question. So you have to, what you're going to do is you're going to tell us whether you have or you've never done or experienced this. And myself, Kim, and John are going to guess whether you have or you never. So don't answer right away.
Okay.
Those in the comments, even if you're watching the replay, watching live or the replay, I want you to please answer the question as well. And then John and Kim and myself, we're going to admit right off the bat whether we've experienced this or not. Okay. So never have I ever called the wrong person, but pretended I meant to call them. Okay, so don't answer that yet. So Kim, you start us off. Do you think that Susie has ever called the wrong person, but pretended that she meant to call them? And then also tell us, have you ever done that?
Of course, and of course. Who hasn't made that mistake? Of course. And I would never admit to it. I would just say, oh, I meant to call you. So good to hear from you.
Okay, how about you, John?
I think it's happened to everybody, and I think everybody does it. If it's somebody close with, can say real quick, I meant to call somebody else, but now we're here, so how you doing?
Okay, so do you believe Susie has done that?
Yeah, Susie's done that for sure.
Okay, so for me, I might not have said I meant to call them, but I've inferred by the way I'm talking to them as if I meant to call them. So I know I've done that more than once. And I think I'm kind of torn on this. I'm going to go with the fact that she has because it's so common. So Susie, we're all in suspense here. Have you or have you never called the wrong person but pretended that you meant to call them?
Yes, I have 100% done that on more than one occasion.
Okay, very good. All right, so we guessed correctly on that. Very good. That was fun. Okay, so let's get your best advice. Let's see. Let's go with John. Give me your best advice for others. Whoever your audience is, just tell us maybe in a minute or so. What advice you'd like to give us?
Advice for a company is to look into the options of ways that you can help to support the individuals that may be going through certain things so that they're not scared to come to you, and make your policies friendly to the people so that work for you, so that they can address it without being scared of losing their job. If you need a resource for it, there's a program in Arizona that I'm part of called Valley Leadership, and we have created all of the different pieces for the company, even the policy and procedures, so that they can start making their company an addiction-friendly company.
Ooh, I like that. That's awesome. Okay, so if you're going to be tagged in this, I believe. So if someone wants more information on that, should they just give you the invitation on LinkedIn, or what should they do? You're muted.
Message me and I will connect you to the site.
Perfect. Well, thank you for that, and I want to thank you for being here today. Okay, and then
Thank you.
Susie. First of all, Susie, I am blown away by what your company has done. That the leadership that to have you in place to not only help patients but also to help employees and their families. I mean, that just warms my heart. So please give our expression for, first of all, allowing you to be here and you volunteering to be here. And then also please convey our thoughts back to the leadership at Legacy and thank them for what they've done. In fact, let me just do this.
Will do.
How about that? See that? Okay. Tell them that for me. Okay, and then Kim, tell us, give us. No, Susie, you're supposed to give us your advice. Sorry, give us your best advice, and then we'll go to Kim. Sorry about
that. So what I would tell people is that there are a lot of resources out there for anyone who's struggling with a substance use disorder. And those range, there are different levels of care for this. There's anything from residential treatment to outpatient treatment to just support groups like we've discussed. That finding someone who can help them navigate or access those services is incredibly important. Or if nothing else, you can go to on the internet, the SAMHSA website has a treatment locator, and you can put in your zip code and find the closest treatment facilities to where you are, or across the country if you want to go somewhere not close to where you are. But there really are a lot of resources available. If you just can figure out how to find them.
SAMHSA, was it substance abuse something or another?
Substance abuse, mental health services administration, I think.
Okay, so
samhsa.gov.
Yeah, Joanne, if you put that in the comments if you don't mind for us, and let's also put in the comments John's organization, the email for the website for that, and of course you can message either of them through the LinkedIn platform because I have them both tagged. And then Kim, give us your best advice, and then let us know what's the best way to reach you.
Sure. Well, I'm in the middle of a downpour right now, so hopefully you can hear me over
Yes.
the rain that's coming down so loud.
We can hear
But
you.
my best advice is for leaders who are watching to recognize that you have the power to transform the culture in your workplace so that your employees feel safe speaking openly. And something that I say all the time is that the most powerful organizations make it possible for employees to remove that mask of fear and shame and speak openly. So my best piece of advice is to train your leadership team to really understand what mental illness is and what it is not. Recognize that according to National Alliance on Mental Illness, 1 in 5 individuals will experience a mental health episode in their lifetime. And if you do the math with the number of employees that you are overseeing in your organization, how many employees could potentially be suffering right under your nose?
A lot.
And you don't know it because your leaders are not fully prepared to say, I just learned that. Now I know what to do. So it's about preparing your leaders, once again, not to become counselors, but to become that first level of safety where employees can say, I'm not okay and I need help. And if anyone is interested in connecting with me, they can connect with me on LinkedIn. They can go directly to my website, kimlamontagne.net, and there's all sorts of information up there, but my training content is up there. And they can email me at kim@kimlamontagne.net. But it is critical. It's urgent that we address mental health in the workplace. It's critical.
Absolutely. So let's get the website for Kim on there, Joanne, if you don't mind. And also we want to make sure that we get the website for legacycommunityhealth.org on there as well. A great organization doing great things here in the Houston area. And I'm honored and tickled pink. I'm wonderful. I'm just so happy that we're working with you guys, Susie, in helping you guys get what you're doing done even that more effectively by bringing in great talent. But I'm just so excited that we had all three of you here today. All of you gave different perspectives that I really appreciated. And I think it helped our audience too to have more of a holistic view of this. And so thank you, all of you, for what you did. So I want to give you this kind of applause. I don't have a physical audience for you, but at least I have this. This is how we would be if we were in front of you. So thank you so much for what you've done. Keep up the amazing work. And let's say, don't log off just yet, but let's just say bye to everyone. Bye, everyone.
Bye, everyone. Thank you.
Oh, and I didn't get a chance to acknowledge Rosina Malaskas. Thank you for your comment today, Rosina. And all of you who are watching the replay, please put in your comments later. Don't be shy. Let us know you were here. Say hello, because we're going to read all those comments. Okay, so Jonathan, let me know when it's okay to go ahead and stop the stream. Oh, I forgot to do my water break. Susie just reminded me of that. I think we're probably good. I don't hear Jonathan, but I think we're probably good at this point. Are we, Jonathan? Can you hear me? That's right. John's not in the room.